Welcome, viewers and listeners, to another edition of CHP Talks. I'm here with a repeat guest, a real person that I really admire and appreciate him taking the time to be with us, Dr. Chris Milburn from the East Coast. He works in Canso. Chris, thanks for joining us today.
Thanks so much, Rod.
Yeah, and I'm going to give you a bit of an introduction. It's been a while since you were on, and a lot has changed in our world since then. So Dr. Chris Milburn is a Nova Scotia-based family and ER physician. In 2019, he wrote a viral op-ed for the Chronicle Herald describing the difficulties in dealing with violent criminals in the ER setting and lamenting the loss of personal responsibility in society. For that, he faced a college complaint from a group of left-wing activists, and he was represented and successfully represented by the Justice Center for Constitutional Freedoms. They've done a lot of great work in recent years. Chris once again ran afoul of the medical establishment in June of 2021 when he spoke about COVID policy on a radio panel and criticized forced vaccination, school closures, and government overreach. Chris and his wife, Julie Kerwin, also a physician, they continue to be outspoken on their blog, paradox.substack.com, P-A-I-R-O-D-O-C-S, paradox.substack.com. And they also have started some years ago the freespeechinmedicine.com, or that's the website, the Free Speech in Medicine Initiative, and they've hosted a couple of great conferences in Cape Breton, and that was all during the COVID time and things that were going kaflooey all over the place. And so, Chris, that's how I got to speak with you the first time, and I had the pleasure of walking with you on the beach there, close to the hospital where you work. And just thank you for taking the time. I know you've had a day of work here today and in the hospital. Are you in emergency today, working in the emergency room?
Yeah, so my job, Rod, and you've been here to the hospital and seen it. I work in a little micro hospital in an isolated coastal community here in Nova Scotia, and I'm an old-fashioned family doc. I do it all. I work in the clinic during the daytime, but I'm on call for the emerge 24/7. And if somebody has an emergency, they call me and I rush over and we deal with it. And I also look after my old folks in the nursing home and my palliative care patients, and I take off lumps and bumps, and I do it all, everything. But we don't deliver babies here unless they're in a rush.
Yeah. Okay. All right. Wonderful. Well, thank you so much again for joining us, and a lot of water under the bridge since we last spoke. And first of all, I'd like to maybe ask your thoughts about the crumbling, the decay, collapse of our medical system in Canada. I don't know, how it is in your neck of the woods, but here in British Columbia, the left coast, as we call it, our medical system is in a shambles. We have a shortage of doctors and nurses, a shortage of there's waiting lists for almost everything that we require in the medical realm, and I don't know where that's going. Let's have your comments on what the driving factors were in the collapse of the medical system, if it is, and if you agree with me that it's gone through an upheaval and a destructive kind of a dwindling of resources, and what we can do about it.
Well, I totally agree, Rod. And it's hard for me to be succinct, but I'll do my best. I'm not known for that. The problem as I see it, so I'll start by something that sounds like a non sequitur. If you hire a contractor to come and do your deck, and he's somebody from your neighborhood and you know him, and you set the price and he agrees to it, and you shake his hand and you look him in the eye and he builds you a deck and you're happy with it, that kind of interaction is good, right? There's feedback. You can pick the person you want. they're proud to do a good job. You're happy to have a good job done. You don't mind paying them what they're worth. I've never heard somebody be really happy about how much a government employee gets paid. Somebody who, let's say, works at the DMV, and you go there and you wait for hours and hours and hours just to get your license renewed, and it's a hell on earth in there. And the employees are generally cranky, and they're going to break just as you've been waiting for 6 hours and whatnot. And nobody's happy with that. And that's because the government runs that. And they've inserted themselves between the person needing the service and the person providing the service. So there's a real disconnect. I personally, now that I started med school in 93, so I've been over 30 years in and around hospitals. And I've come to the conclusion that I think Canadian medicine was still good in the 70s, 80s, and somewhat into the 90s and 2000s because it was basically running on the fumes of old-fashionedness. Medicine used to be a direct pay. You selected your doctor. That doctor was there to perform a service for you. There was competition amongst doctors. I've talked to elderly physicians who talked about how difficult it was to start a family practice because there was so much competition. You had to provide a real service to your patients and be available to them even after hours. You had to be friendly and kind and caring. And if so, you got a reputation, eventually build up a practice. Eventually, the government kind of restricted the number of billing numbers and things, and they cut the number of physicians, and physicians basically got paid more and more to do less and less. And being run by the government, what happened is we have more and more managers and more people running around doing less and less. So we have more and more people doing less and less until everybody's a healthcare person, but there's no healthcare being given. And that's where I think we're heading towards this singularity where we're almost at zero access to healthcare despite massive increases in expenditure. COVID accelerated some of the processes. It was actually really, really bad even before COVID. And I think many people maybe were a bit blind to it before COVID. But COVID accelerated and exposed a lot of the failings of our healthcare system. And so one of the things that's really went on steroids was there was a bit of kind of quote unquote work from home, which I call it don't work from home, right? If you're a nurse or a doctor, you really need to put your hands on a patient and look them in the eye and see their color and feel their belly and things like that. And the idea that you can be sitting in front of a pool on your laptop and texting or looking at them on the screen and giving them quote unquote healthcare, I just think it's ridiculous. But COVID really accelerated, and not only were some patients are into it because it's convenient. They can get what they think is healthcare without leaving the comfort of their home. Doctors and nurses love it because they can stay at home and look after the kids and cook a meal and get paid just as much as somebody who actually goes into the hospital and changes a poopy diaper and has to deal with the old lady with dementia who's screaming at them. So some of the patients like it, the physicians and nurses like it, and the government can give the illusion of improving healthcare by doing it. So that has really, really ramped up. I can't speak for other provinces, but here in Nova Scotia, that has been a huge factor, as well as they've greatly increased the management to frontline worker ratio over the last number of years. Just in my one little area here, rural area, we have numerous more managers than we did, and nobody knows who's in charge of what anymore. We can't keep track. If you want to get something done or changed, nobody knows who to ask. Even when you ask a manager, they don't know. They'll say, "Oh, I'll look into it. I'm not sure if that's John up in the next community or whether it's Sandra in Halifax, but leave it with me." And then 3 weeks later, you haven't heard something, and the problem's still unresolved. So healthcare is falling apart because it's run by the government. And I've said before, maybe not on your podcast, but Canadians, the big thing that Canadians don't understand about healthcare is that taxpayer-funded healthcare is different than government-run healthcare. Those are different concepts. There's many advanced countries with government-funded healthcare that have privately run healthcare services. So the government will pay for you to have that operation, but you can choose where to go. And doctors or business people can run a hospital. And if they give a good service, they'll get business. And if they don't, they won't. And that creates competition. It creates great service. But here in Canada, nobody has to give you good service because it's like, well, what's your choice? If you have enough money, go to the US, go to India, go to Mexico. But, if you don't like being on a 1.5 wait list, too bad. At least it's free Canadian.
Yeah, yeah. Well, so-called free. I mean, of course, there is no such thing as a free lunch or free health care. It costs somebody, even the dollars that go into it come from the taxpayers, right? And we certainly think that we should be getting, whether it's highways maintenance, whether it's Canada Post, or health care or education, like we should be getting the best possible bang for our buck when taxpayers are already strapped. Average person out there is strapped, and this stuff is not free. Well, they can kick the can down the road and borrow the money, as what the federal government is doing, and probably most of the provincial governments and even municipal governments are borrowing funds to operate inefficiently, and that money still has to be paid back or accounted for in some way, shape, or form, even by inflation is taking its toll and so on. But that's a broader topic.
It is. Well, one of the things another thing that Canadians may not understand is that, when I say free, if it was up to me, once I'm king of Canada, I'm going to make it illegal to talk about free this or free that. It's all taxpayer funded is the right name. Exactly. And about 1/3 of anyone's tax expenditures go to pay for healthcare. So if let's say you're doing well with your business, building garages, and you're making 150 grand a year, and you're giving back 70 grand of that to the government, well, 1/3 of that is going to healthcare. So over $20,000 per year you're paying to get healthcare. But then when you go, like a third of the people in Nova Scotia don't have a family doctor, and they have to sit in an emergency room for 12 or 14 hours just to get a prescription or something. So, they're paying 20 grand a year, but they can't get healthcare. And the same people, as I say, Canadians are so blind. They say things like, "Oh, well, at least I'm not in the US where I have to pay for healthcare." Well, in the US, number one, you probably wouldn't pay over 20 grand a year, or you might, but you'd actually be able to access somebody, right? Yeah. And nobody would put up with it in the US because they know they're actually paying. They see that they're paying, and they wouldn't put up with not getting care. They would scream and yell, whereas Canadians just say, well, at least it's, quote unquote, free, right?
Yeah, I think COVID, technology and COVID have interacted in such a way. I know that in our hospital, it sort of feels more disconnected now. You're going through a process to get seen, but it's not quite the same as talking to somebody immediately and getting prioritized, or having an effective triage put on you. It may be, the triage may be applied from a distance, but not from someone in the same room with you. Actually assessing what you're going through and how critical it is. And the fact that you even need to be put on a priority list is already kind of questionable. And so many here, where I am, northern BC, so many do not have a family doctor. And you're exactly right. They're going to emergency. And we've gotten used to, as a people, we've sort of gotten used to doing things by electronically and COVID and show your card and whatever, and much less that you're actually seeing somebody who cares about you. And when we start JAG today, the first thing you ask, how are you doing? And you like to hear those kind of questions from people who know something about medicine.
Well, Rod, you mentioned triage. Triage is a great example of how bureaucratized healthcare can kill people. I'll sort of give you the short version of a long story. Triage, many emergency rooms used to walk into, and the first person you see was a clerk. And the ward clerks, when I first started working, that was the way it was. The ward clerks were not stupid people. They could look at somebody, and if somebody had their hand cut off and they were squirting blood, they would run and get us. Or if somebody was clutching their chest and their right, they would run and get us. So there was effectively triage, but it wasn't official, right? But then, of course, a well-meaning bureaucrat said, well, no, we need to have a nurse to do triage. So they took a nurse who would be normally seeing patients, and they stuck her in the front in this new room that they built. And they said, now you're the triage nurse. And that was a little bit destructive because it took that nurse out of actually caring for patients. But often those nurses would kind of, when there was nobody coming in to triage, they would drift inside and help out and keep things moving. But then more and more they said, no, you have to be there every moment, because if somebody comes in and you're not all right there, no. So that nurse would often sit there for long periods of time and do nothing. But then what happened was, it used to be that the nurse could just basically do what the ward clerk had done. They look at the person and say, oh my God, you look really bad, come in here right now. But then they systematized it and they algorithmized it. So it was like, no, you can't use your own brain. You have to do this. What's your pain level out of 10? As the person's clutching their chest, What's your pain level out of 10? Have you been exposed to COVID recently? Have you had your COVID vaccine? And literally the nurses would get their hands slapped if they hadn't filled in every box on the 3 or 4 page form. So triage went from literally a gestalt that took, in some cases, moments where they would run somebody inside, to suddenly a process that takes 10, 15, 20 minutes. And what happened now is we have a waiting for triage. And that can be, I've actually experienced this with my own mother-in-law before she passed away. We brought her in. She was so ill, she couldn't stand. And there's a lineup. And I said, we said, where's triage? And they said, oh, you're in the line for triage. I said, but no, she can't stand. She needs triage. No, it's about a 2-hour wait. And then they said, well, where can she sit down? There's no seats. My mother-in-law said, take me home. And so we went home, and she ended up later in the day, she collapsed and had to go in by ambulance, but she literally couldn't stand for 2 hours. And so that's what we've created. Bureaucracy has taken triage from something that might've made sense and it's made it into a farce.
Yeah. Well, I've noticed Canada Post is an example. We've got some great people who work in our local post office, but the process of putting a package in the mail is a lot more complicated now than it was. I mean, we used to mail a lot. First of all, we mailed more letters. Now, obviously, we use more email. But packages, you'd bring it in and they'd weigh it or whatever, and away you go. Now they have to fill in a form for it. And if you're mailing, I found out mailing a book to the U.S., I actually had to bring my prepared package back home and go online and register the fact that I was mailing a book. Now, some of that may be due to probably the tariffs and things like that, but the reality is the system is broken. You think you have a postal system that you can go in and they can deal with it, but it's not their fault. They can't, because the rules have been imposed on them from above, same as you're talking about with the triage nurse.
Mm-hmm. Absolutely.
I saw today, walked into a government building downtown, and there was a notice in downtown Smithers, a town of 5,000, notice, a sign on the door, COVID-19 vaccines, and there was a direction, an arrow pointing in one direction, flu vaccines, an arrow pointing another direction. And I thought, really? People are still taking, after all we have found out about these COVID vaccines? There's never been a public admission of the problems that were caused by the COVID vaccines. But, of course, the flu vaccines is another whole issue, and I know you've recently written about them. Maybe, first of all, maybe also thinking about, we were going to talk about a little bit about RFK Jr., so I don't know where you want to jump in on that topic in general, whether you want to start with RFK down in the South as the Health and Human Services Secretary, and then get into flu vaccines, but
sure.
Take it away.
Well, maybe I'll kind of to tell it as a little narrative here. as I was going through med school and into residency, I was, typical doctor. I thought vaccines were a great thing and whatnot. And as a kid, I got certain vaccines. I was just after measles vaccine started. So I was born in 1969. So I got one. My wife didn't. She had measles, not a big deal. Got over it. But I got the vaccine and, I thought, oh, this is great. You won't get polio, you won't get measles. But when I was early in my career, Rod, a couple of things happened. Firstly, flu vaccines came out. And when they first came out, the idea was they'd be for seniors, especially the ones who were unwell and had risk factors. And I thought, oh, okay, that makes sense. I've seen a lot of old folks get really sick with the flu and even die. And maybe if we could prevent that, that makes sense. But then it very quickly was, oh no, everybody should get one. And I quickly fell off the rails with it. And I remember many times trying to talk parents out of vaccinating their poor little kids who are sitting there crying, not wanting another needle because they just had their school needles and now they're getting dragged in to have a flu needle. And I'm looking at this healthy 6-year-old and trying to tell the parent, this is just not a good idea. He's a well kid. But it was really getting pushed in public health, had all these things up, flu vaccines save lives and all that. And maybe at the time I probably believed it for seniors, but I just thought, why are we pushing these on kids and healthy younger adults? And by younger, I mean under 65. I thought it was ridiculous. And then to me, the public health really crossed the Rubicon with universal vaccination for chickenpox when it came out. Because I had seen lots of chickenpox in my early career. And yeah, there were kids who were kind of miserable and they were feverish and they had a snotty nose and they had this rash and they were itchy and crying. But generally, it was one of those things that I don't know, Rod, this is maybe a terrible way to look at it, but it was almost like a bonding between parents and children. I remember really well my mom and dad nursing me through chickenpox and being miserable for a few days and how wonderful they were to me and how they kept telling me, you'll get through this, it's itchy, but it's going to go away. And it was one of those trials of life that as a kid, I look back and I think it was almost good for me to go through it. And also you get lifetime immunity, right? So when they started saying like every kid's got to get a chickenpox vaccine, I was like, well, why? It's just chickenpox. I'd never seen a kid really sick, hospitalized or die from chickenpox. And I'd been around hospitals a lot by that point. And so I was getting off the rails with all this vaccination for everything. But then as people will know, over the last 20 years, 30 years, the number of vaccines that we give kids has just exploded. And now it seems like we vaccinate them against like rhubarb exposure, for gosh sake, and it's just sort of driven me crazy. And now these poor little kids, we drag them in over and over and we poke them with multiple needles, they're combination needles with multiple things. The kids seem to have more reactions. And then there's that question of, why is there all the autism around? Why are we seeing ADD? Why are we seeing an increase in autoimmune disorders in younger people? And it may very well be because we're messing with an immune system that's infinitely complicated. God has created this amazing immune system, and we think we can just tweak it at our leisure, and we probably can't. So, unlike many of my colleagues who are railing against them, I think I love what RFK has done. Despite what the media has portrayed, he's actually being extremely reasonable with it. He's not said you are not allowed to vaccinate your children. What he said is we're no longer recommending universal vaccines for A and B and C. And I don't want to get into too much technical detail, but one I'll mention that was the low-hanging fruit was we were vaccinating newborn kids. They would pop out of the womb and we would stick them with a Hep B vaccine at birth. Now, Hep B is a disease of prostitution and drug use mainly. And there's not many newborn babies who pop out of the womb and say, give me that fentanyl needle, friend, and take it from somebody else and stick themselves with a dirty needle. There's not many newborn babies who get into prostitution. There are very rarely newborn babies born to Hep B positive mothers, but we test the mothers during pregnancy. So as far as I could tell, and I talked to many wise people who are much smarter than me, and I could not get a good answer as to why in the heck would we vaccinate a newborn baby for Hep B. Especially because by the time they're teenage, it's worn off and they need to be revaccinated. And that's the time where maybe a kid would be into something bad. And if you think they're at risk as a parent, you could get them vaccinated then, but they just don't need it as a newborn. So the fact that the medical establishment and the Academy of Pediatrics, et cetera, screamed and yelled about that being removed just tells me that it's not logical. Their opposition is not logical. It's hysterical. It's RFK derangement syndrome. Anything that he does is automatically wrong, and they're going to yell against him. Even if he said, we want to cure all cancer for babies, they'd say, we want more cancer for babies, you know?
Yeah. So he's used some figures that he said autism used to be 1 in 10,000, something like that, and it's now like 1 in 30, and I think in California 1 in 12 or something like that. Boy, I don't know if those are. Am I getting these numbers right?
You are. Now, there's a lot of debate over the numbers. It's because the diagnostic criteria have changed and the incentives for being diagnosed have changed. So one of the reasons that it's so popular in California and several states is that those states provide taxpayer-funded services if your kid is declared to have that condition. So parents will, and I've actually experienced this in Nova Scotia because we have somewhat of the same thing to a lesser degree, but if you can write a paper saying my kid is autistic, I can get a special tutor and he can get special allowances for exams at school, and he can get his own private room at university for no extra cost because he's autistic and he needs the private room. So there's all kinds of incentives to be autistic. So the diagnosis has increased, but there is also no question that autism has really increased by a lot. Now, has it increased by 3 times, 5 times, 30 times? There can be lots of debate over that, and I'm open to the debate and the different ends of that spectrum, but there's no doubt that it has increased massively. There is some kind of environmental trigger. The people who are excusing this and who are anti-RFK have said, it's genetic. Well, our human genetics drift over many generations. Yeah. And you just can't be explained in 1 or 2 generations. So that just doesn't hold water. There's something going on. I tend towards vaccines or some kind of environmental toxin, but who am I to know? And I have a lot of respect for people who have different views on it.
Yeah, it's. I think RFK has gone after not only. He hasn't been completely just a blank check against vaccination, but he's gone after mercury and aluminum in vaccines, which, I mean,
fluoride in water.
The things we know today about those things. Yeah, there was a time when asbestos was a great deal. Nobody realized that it was going to cause cancer later on in life. My dad voluntarily participated in a test study for DDT way back, not knowing that eventually DDT would be, they're thinking here we're doing something for humanity. We're going to help, eliminate, insect-borne diseases and things like that, and it turned out to be a disaster. So thalidomide, so many things that were once thought to be a medical breakthrough end up being a medical disaster. So my hat is off to RFK Jr. and the work he's doing down there. He's getting a lot of flack, but he is carrying on bravely, standing up to the slings and arrows, and I hope that he has good success, and I hope he has a good security detail as well.
Indeed. Well, and I don't know if you know this, Rod. I don't know if I told you this, but he interviewed me on his podcast. Oh. I was on his podcast several years ago, and I really have a lot of respect for him. He's a very intense guy, but I have a lot of respect for what he's doing. And what's funny is people could even go back and listen to that. It's still posted on his channel, but Julie credits me with pushing him to enter the presidential race because of some of the things I said.
Well,
I criticized the Democrat Party. He was very defensive of the Democrats, and I basically said, like, they've gone crazy. Somebody needs to step up and tell them they're crazy. And next thing, he was going for the Democratic leadership. Julie says that was me. I think he was probably well on that process already, but maybe I pushed him over the edge. I don't know.
wonderful. My dad, when we lived in Western New York State when I was a kid, my dad had a letter from RFK Sr. He was at work with the Seneca Indians trying to defend they were being pushed off their land. At that point in time, they had to abandon their houses. Their land was flooded after a treaty they had signed by George Washington that promised them that that land would always be theirs. Anyway, my dad was working with them, and RFK Sr. was the Attorney General at the time, and so Dad had some exchanges. Anyway, we always liked the Kennedys in those days, and I sure like this one in these days. So there's a great video about him on Angel Guild. I don't know if you've seen it, but the true story about RFK Jr., and it's well worth watching because he's not only been an outspoken critic of some of the pharmaceutical industry and some of the food chemical industry, agricultural chemicals and so on. He's been a defender of clean waters. He's worked to defend them. But as a young person, after his dad and his uncle were assassinated, he went through a period of drug addiction, and he overcame that and is now just a tremendous person, doing great work for the U.S.
Yes. And I will say too, Rod, to add to what he's doing, we had talked about it a bit before this, but I really like the changes in the food guide too, right? For years, there was this move, like basically fats are bad, low fat, low fat, low fat, low fat, which meant basically high carb. Yeah. And I'll never forget the kind of the nadir or the low point of that was, I remember around 2010 or a little earlier, picking up a bag of Twizzlers and showing them to Julie. It said low in fat bag of Twizzlers as an advertising point. And that's how crazy we got. We were so fat paranoid that people figured they could eat any sugar with impunity. But it turns out really probably sugar is much more the villain than fat. And fat doesn't seem to actually cause all the problems that we talked about. I think the problem, and the general thing I like about RFK is he's, whether it's about antidepressants or vaccines or food or whatever, he's kind of come down on the side of natural food, exercise, minimize potential toxins, which include potentially medications and some vaccines. That is the way to good health. The medical good health doesn't come from outside of you. It comes from what you do and your habits, and the government's there to support you, but this is not a nanny state. We're not going to make you healthy by injecting you full of products and giving you a bunch of pills. Right. You can make yourself healthy. Here's a food guide. Here's an exercise guide. Go do it. And I love that.
Excellent. Really appreciate what he's doing. Now, just recently, I mean, because when we first connected, a lot of it had to do with the COVID overreach and the imposition of things on Canadians, the attack on our human rights and so on. And we recently have seen the Emergencies Act that Justin Trudeau implemented got a shakedown in court that I think was a surprise. It was a pleasant surprise to people in the freedom movement, and probably a bit of a shock to those sitting in their ivory towers in Ottawa. So what was your response? Just talk about the judgment that came out against the Emergencies Act.
Well, I thought it was wonderful, but I'm also cautious not to get too excited. So firstly, it's wonderful that decision came down, because I think anyone with a moral compass knew that that was the right decision, right? And the courts are supposed to be a reflection of our morality. The court is there, yes, to uphold the law, but the law is supposed to be a reflection of our country's morality, the moralities of the citizenship. And it seems like more and more we're drifting away from that, and the courts have been captured and become more and more run by a woke elite, So this was really heartening to see. So that's the upside. It was wonderful, and it may open the door to some civil lawsuits. Unfortunately, a finding of liability with a bureaucracy, liability doesn't mean accountability. Liability means that the taxpayer, if somebody sues the government, the taxpayer shall pay them. Okay. And so, not that some of them shouldn't be paid, but it's going to come from the rest of the citizens of Canada. So Justin Trudeau is not going to pay any price, and the chief medical officer of health is not going to pay any price, and the police chief of Ottawa is not going to pay any price, and none of them are going to pay a price, right? No. I've said before, but trying to fight a bureaucracy is trying to punch a cloud. Like it's too diffuse and nebulous, and there's great thinkers and writers who've actually written about that and put it in a better way than I can. But they've talked about how part of the purpose of a bureaucracy is to spread responsibility so thinly that the buck stops nowhere. Like for instance, just going back to the healthcare system, I had a 42-year-old lady who died of a cancer that potentially she didn't have to die of. She waited months for a CAT scan, and then the CAT scan result wasn't read, and there was a delay, and then there was a delay in getting her into the next specialist, and that specialist delayed getting the next test and whatnot. And next thing, it was 7 months had gone by and she had received no treatment, and then they just said she was too sick for chemo, she's too far gone, and she died. And her parents considered suing, but who do you sue? Because it's not really the first doctor's fault, because the delay in the CAT scan is just the waiting list. It's not really the second doctor's fault, because it was his secretary who misplaced the file. And again, like, you can't really say there's anybody in that whole process that you hate, or that's your fault and you should wear this and you should go to jail or you should pay. That's the problem with the bureaucracy. And that's the way I see it with this decision, is that that's great, but no one person or no group of people is really going to pay a price. And so is it really a deterrent for a government in the future? Or the fact that it's taken 4 years and nobody's really going to pay a personal price, does that just give them free rein to do the next thing next time? I don't know. I hope it scares them a bit. I hope it scares them straight, but I'm careful not to get too excited, even though I am happy that the decision went in that direction.
Yeah. Well, that's kind of what our response too. We're very, very pleased with the result. It shows that there are at least someplace there is a judge and a court that actually is following the Constitution and taking their responsibility seriously. But the sad part is 4 years after the fact, a lot of damage has been done. For instance, Tamara Leach and Chris Barber have been dragged through the courts for several years. Some of the truckers are still facing civil lawsuit, and there were people who were physically damaged. I've talked to some young men who were, punched and shoved around that didn't have to be. And what does that do for their sense of the public institutions of this country? Absolutely. Chris, before we close, anything else? I think we could go on for quite some time. You're a wealth of information and some thoughtful analysis of the situations, but I want to be sure that you get to say what you want to say before we close off for the day.
You are kind. I'm a wealth of words, if nothing else. But maybe the last thing I'll say, just sort of in a brief way, is I'm currently writing about the whole hoopla about the Somalia daycare scandal in Minnesota. Really hit home to me, and I'll tell you why. In 1991, I was a young, naive kid, and I was living in Ottawa for the summer, and my friends came over for the Canada Day party, and we kind of went in different directions early in the evening, and then we came back for a house party later that night. And one of my friends is particularly gregarious, brought three immigrants in tow with him. He had met them, and he said, "This is, Abdul and Mohammed and Ishmael, and they're from Somalia." And I told them to come on over to the party. And these guys, at the time, I was really excited. "Oh my God, you're from Somalia! Tell me about Somalia." And I noticed they were very standoffish and not very friendly. They weren't strict Muslims because they drank most of our beer and they ate a lot of our food, and they seemed fine with that, but they weren't very friendly and they didn't talk to us much. And then one of them said, "Where's the bathroom?" And he disappeared upstairs for quite some time. In retrospect, quite a long time. And he came down and he said, "Oh, we got to go." And I was like, "Oh, no, stay. Party's just starting. We're going to strum some guitars." "No, we got to go." So they left. A while later, one of my housemates went upstairs and said, came down white and said, "We've been robbed." And this guy who had gone upstairs had tossed the house, and he stole, somebody had cashed their paycheck, and he stole all the money and jewelry, and lots of stuff was gone. And anyway, my uncle, I talked to him a few days later, and my uncle's response when I told him, "Yeah, these Somalian guys came over," and he said, "You invited Somalians into your house? What the hell were you thinking?" And I said, "Well, I didn't know." And he explained to me that Somalians are not Canadians. They do not have a golden rule. In fact, their rule is grab whatever you can, whenever you can. The only people you wouldn't do that against are maybe your family or your close tribe. But anyone else you can get something from, you do. That's the way. It's a dog-eat-dog ethos, a dog-eat-dog society. And so when I heard about this happening in Minnesota and all these 100,000 Somalians now who stole billions of dollars, my thought was, Tim Waltz, you invited all those Somalians in your state. What the heck did you think was going to happen? Because it was my experience as a 21-year-old writ large. And to me, it just shows that, despite a lot of people who have forgotten this, we do have a Christian ethos in our society, do unto others. Most Canadians wouldn't consider stealing. We do have our criminals, but to invite three random guys off the street who are Canadian, maybe grew up in that Judeo-Christian philosophy, if you invite them over and treat them well, it's very unlikely they're going to toss your house and steal everything they can. But it's in Somalia, that's just called Tuesday, right? And so I think we have to, this Minnesota happening is something that should make us look at ourselves in a mirror and say, what do we want? What are we supposed to get out of immigration? Yes, we want to help people, but we also have to consider our own citizens and improving our own country. And when we invite huge amounts of people with a very different ethos and a very different way of looking at morality, what does that do to us as a society?
And in a practical sense, strictly numbers, like the millions of people that we have brought in from any country whatsoever. I mean, Somalia among them, but we need housing, we need health care, and those, both housing and health care, have been severely stressed by simply the numbers of people that we brought into the country. Now, when you add a different worldview that doesn't share our values and so on, that makes it that much more difficult, challenging.
I agree, Rod. But I would also say, just at a more basic level, I don't care if it's 10 or 100,000. I don't want somebody in my country who thinks it's okay to steal from somebody who invited them to their house. I don't want somebody who thinks it's okay to do female genital mutilation on their 13-year-old daughters. I don't think they improve our country. And so to me, it's not just a matter of scale. That makes it that much more worse. But I think it's also just the ethos of these people that we're selecting. We have to be very careful about it.
Well, we have found, and I'm taking this a little bit longer to close off, but I want to comment on this. Alberta, I don't know if you heard my recent interview with Brian Peckford, former Premier of Newfoundland, but who was he is the last living signer of the Charter of Rights and Freedoms. And he told me the story. He had sent me the news clippings ahead of time, but there's a fellow in Alberta who came from communist China. He's a lawyer. He was a lawyer in China, living under communism. He's now a Christian lawyer in Alberta, and he's having lived under communism, he doesn't want to live under communism again. and he went to his law society, of which he's a member, and asked them he made a motion that they would support the supremacy of God and the rule of law, which is the foundational statement in the opening, our very first statement in Charter of Rights and Freedoms. Canada is founded on principles that recognize the supremacy of God and the rule of law. And the Law Society, his fellow lawyers in Alberta, of all, whatever backgrounds they have, but they're not all from Somalia, many of them born and raised in Canada, they voted about 90% against promoting and protecting the supremacy of God and the rule of law. So that's an indication of where our country is at. And I always go with Romans 1. When we reject God, he gives us over. When a people reject God, he gives them over to delusion and to do things that are not convenient. And our politicians and our courts have been doing a lot of things that not only aren't convenient, but are against our very Charter of Rights and Freedoms and against the moral values that many of us hold dear and that made this country great. So on that, it's kind of a sad note to end on, but the good news is that you, as a doctor and as a citizen of Canada, are not only doing a good job as a doctor, but you're fighting for the clarity and the truth and the behaviors that we need in our medical system, in our politics, and in our. You're fighting for the good values that Canadians once held universally and can hold again if they choose to. So.
Well, thanks, Rod. I'll take that. I'll take that opening to just say, I really, really feel blessed that the last number of years has been a very difficult time in my life with a lot of upheaval and change, and I've been kind of cast out of certain circles and whatnot. So it's meant a lot to me to meet people like you and have you care enough to reach out to me and talk with me. And it's been very heartening to know that there are people like you in the country fighting for the things that I care about and really dedicated to them. So thank you for all the work you do. It means a lot.
Well, thanks so much, and God bless you. If I ever need an emergency room doctor, I wish it could be you or someone just like you.
I will pray you'll never need me.
Okay, thank you so much. God bless you. And for those viewers and listeners, tune in again next week for another edition of CHP Talks. Thank you.